Hello and welcome to the Rita Date show. I am so excited to welcome Dr. Nandan Yardi, neurology, your field of neurology. How did all that culminate?
So I got involved in 1993 in Oslo when I presented a award paper there on epilepsy.
Especially kids, I would like to ask about our lifestyle now. Like we are not moving as much.
We are moving in the wrong direction actually. Screens.
With the screens.
Yeah.
You tell kids to get outside.
And it's not only kids, it's adults as well.
Yeah,
Because
adults are worse.
Yeah, they're worse. In the family, you're looking at your cell phone, you're looking at reels, videos and stuff, and then nobody's talking to each other, nobody's even looking in their eyes. So little kids with this loss of sort of contact, eye contact, emotional support, they tend to be autistic.
Psychotherapies.
The occupational and physiotherapies, sensory integration. So they develop abnormal connections, and that causes this kind of a scatter brain, don't have good eye contact, and they remain in their own world, and they prefer to remain in their own world. And they have abnormal actions like stereotypies of hands or repetitive cerebral chanting and stuff. So they look abnormal, and their learning gets affected. Important. So no screens for kids, as little screen for adults as possible, and you'll be happy.
Hello and welcome to the Rita Date show. On today's episode, I am so excited to welcome Dr. Nandan Yardi. He is a pediatric neurologist here in Pune. He has over 3 decades of experience. He set up an epileptic center here. He is also a fellow of the Epileptic Center in the US and the Neurological Society there. He has done extensive research on the subject of lifestyle and neurological diseases. And today we are going to talk about yoga and lifestyle and its effect on these diseases. And he has ongoing research which he will talk to us about. So it's a fascinating conversation. Stay tuned. This is the Rita Date Podcast. I'm Rita Date. I'm a yoga and meditation coach, nutritionist, and author. On this show, we concentrate on 3 subjects: mind, nutrition, and movement. M&M. These are 3 pillars you need to age well and live well. We bring you information and guests that give you practical information, all backed by science. Stay tuned. So Nandan, how did you get started in this intersection between yoga, lifestyle, and neurology, your field of neurology? How did all that culminate?
So I'm basically a pediatrician by training, and during my thesis for my MD, I chose a subject which was epilepsy, where one gets fits, and it was obviously, being a pediatrician, it was children with fits. And we had acquired a new high-performance liquid chromatography machine here in our hospital, which is the BJ Medical College where I was training. And I was asked to do some work in this field on that HPLC. Now the problem was that it was difficult to do biological samples in those days on HPLC. So I had to actually run from pillar to post to set up this HPLC, and then we started looking at blood level estimations.
This is early 1990s.
This is end 80s.
End 80s, okay.
80s. And it was early days for biological samples on HPLC, but we did set it up, and my thesis was on epilepsy. So my focus of interest is epilepsy. Now, epilepsy is a condition of the brain, and it has interactions with emotions, and there is a lot of stigma, and it's also very closely related to lifestyle. So that got me interested in looking at the factors which might affect a person with epilepsy. Then again, my grandfather was a Sanskrit scholar, and he used to always tell me, you're doing medicine and you're following evidence-based, medicine with a lot of science and all that. But I would urge you at some point of time to look at our culture and try to look for some evidence which he believed was surely there. And I should think of doing research on something to do with yoga or such kind of subjects. That's
fascinating that your grandfather...
So I never gave it too much importance in those days, and although it was at the back of my mind. But then I started working more and more in epilepsy, like locally, seeing patients nationally in various conferences. Academically, I was inclined, so we would be doing research on epilepsy. And then also internationally. So I got involved in 1993 in Oslo when I presented a award paper there on epilepsy with a psychological task force of the International League Against Epilepsy. And that is an organization which is represented by 150 countries. The neurologists dealing with epilepsy form chapters in these various countries, and it is today represented by about 150 countries. And this is an NGO that runs works for looking at different aspects of epilepsy, including research. So that's where I came in contact with people who looked at the psychological aspects of epilepsy, and that's where the whole thing got rekindled. That I should look at things like yoga, which we are known to inherit culturally in India, and it probably has very good effect on the brain systems and the body in general, health system. And maybe we should start researching. So I put it up to them, and then that's how we slowly started collaborating with people, international people. About 4 or 5 years after that, there was a world leader in psychotherapy from Sweden, from Uppsala University, Professor Joanne Dahl, who wanted to get her PhD student to collaborate with me.
Oh.
So I welcomed them, and we said we will do a study which will look at yoga and which will look at the short course psychotherapy that she is an expert in, and we will evaluate our patients of epilepsy in my clinic. And they actually stayed a whole year. I mean, they stayed 1 month to evaluate these patients. They would work from 8 a.m. to 8 p.m. looking at patients and then doing individual therapy sessions with yoga, with ACT, which was her.
So was it yoga versus the psychotherapy?
Exactly, yes.
So okay.
So we did that, and we actually completed that study at the end of 1 year. So they stayed almost 4 months of the year with me. And then that study is one of the 2 studies that has been approved by the Cochrane Foundation. The Cochrane is a very strict body in the UK which looks at the methodology of scientific research. So out of 164 yoga studies that they looked at, ours is one of the 2 that has got approved.
So what were the conclusions?
The conclusions were that both short course psychotherapy and yoga helped patients with epilepsy in improving the quality of life, number 1. And we use certain scales. It's all methodologically properly done. That's why it got through Cochrane. And so one is quality of life. We also saw some changes in their EEG patterns. There's the brain waves.
The brain waves,
yeah.
Okay.
So there's positive impact on the brain waves. And also some definite reduction in the number of seizures that this patient gets. So it did help epilepsy, and it also helped the quality of life.
Oh,
And we have those patients still practicing yoga. Many of them don't follow up with me because their seizures are gone, and it's been about 20 years now that they're practicing. So that's how I was brought into yoga. And then we continued this research. More recently, I was headhunted by the Cleveland Clinic and asked if I could help them write a project because they wanted to look at lifestyle and neurology, specifically epilepsy. And with the chief of the Cleveland Clinic, Epilepsy Clinic, I helped him write the protocol, and the study is ongoing for 5 years. We're almost finished about 2.5 to 3 years now.
Wow.
Yeah.
And do they integrate yoga in their program?
Yes.
Okay.
Yes. So it's yoga. Then there is culinary medicine, aiming at gut-brain axis, and because that's a big thing now to affect disease and health. Then they have music therapy. And of course, they have all the various psychotherapies like cognitive behavioral therapy and others.
Yes, that was there before. So now they've added
I'm currently involved with the Cleveland Clinic.
Wow.
Yeah, for the last 3 years.
Okay. I think it'll just get more and more.
Yeah, the whole idea is to create a lifestyle neurologist in the US to tweak the pattern of health-seeking behavior of Americans.
Okay.
So that they can go more for alternative and complementary therapies. Rather than just depending on, basically evidence-based medicine has its limitations. So there is something beyond that which people should be offered. And this research will probably, once we are getting good results, initial results. We have not completed it yet, and we'll be able to come out with the results probably in another year's time.
Okay.
But I'm pretty confident that many of these complementary and adjunctive therapies, we ask the patient to continue their medications and other things as per evidence-based medicine, but on added adjunctively, some of these therapies do help in improving the disease status.
So just taking a step back, for those who do not know, what exactly is epilepsy, and are you born with it, or does it come to you later? Just
Okay.
to give the layman
epilepsy is disease of the brain where there is a sudden excitation of a group of neurons due to various causes, right? And whenever that happens, there is an impediment to the brain functioning. So a person can lose consciousness, can have stiffening of muscles or jerking of muscles, may fall down, may bite his tongue. And there are 20 or 25 different types of manifestation depending on the area of the brain. Whether it's just focal area of the brain that's involved, then it can cause just disruption of the function. Say if there's an area of the brain which is representing the hand, then you can get tingling in the hand or movements in the hand, and the person is aware because it's focal. The rest of the brain is preserved awareness. But if there is the other type, the other major type is the generalized seizure, where the entire brain gets affected with high voltage discharges. Then the person first loses consciousness and then may fall down and then have the other manifestation. So this is what the entire spectrum of.
How much is genetic and how much is?
But 20 to 25% is genetic.
Okay.
But as we are doing more genetic tests, we are finding many more subtypes of epilepsy that could be genetic. So we're going to see a slightly increased sort of in a population of patients whom we thought were not genetic but are genetic. It may not be hereditary, so it may not run in families. That's only 20%. But single gene defects or some kind of freak occurrence of genetic abnormalities by nature, which are called mutations, we are finding many of those which are directly linked to.
So the ones that are not genetic, tell us about
that's
those.
A very good question. So most commonly it is a problem in the birth process when a child is born, that the child does not cry immediately after birth because of a difficult delivery process that can cause damage to the brain, and that may manifest not immediately. Sometimes immediately, but sometimes after a few years, because there has been some kind of a scar in the brain or damage to the brain.
That's from the actual birthing process, or in the womb?
And it's probably a delayed birthing process, right? Which is causing loss of oxygenation to the baby. The baby is not cried immediately after birth, which we call birth asphyxia. So this is one of the commonest ones. But there are others, like the baby's brain may not have developed normally, could have inborn developmental abnormalities in the brain which can produce seizures.
And that cannot be, you cannot tell from the testing.
There are some tests, genetic tests, and there are sonographies and other things which can be done. And but you need to suspect that. And a lot of obstetricians look at all this now. Then in a child, brain infections can cause seizures like meningitis, encephalitis, and in some of the developing countries, it's tuberculosis of the brain. Sometimes one can have worm infestations like tapeworm. So the worm remains in the intestine, but the larvae of the eggs go in and sit in the brain through the bloodstream, and they can cause inflammation. Then there are brain tumors. There could be metabolic abnormalities which can cause seizures. So there are many causes. Or even head injuries for that matter. So use of helmets while going on two-wheelers is very important. So traumatic brain injuries of different sorts.
So listen, wear helmets, everybody.
Yes, absolutely. So remember that.
Even for your kids, when you're taking a child on the bike. Keep that in mind.
And the pillion should always wear a helmet for sure, because often the pillion who falls down
falls this way.
First, and so it's important, right?
So in your clinic, you have an epileptic center at the moment.
Child neurology and epilepsy. But we do see epilepsy I do see epilepsy across the ages.
Across the ages.
My training was on children and adults. So we get across the ages, right from a newborn till maybe 80 or 90-year-olds coming in with epilepsy.
So how do you integrate yoga with them? Like, it's individual, obviously?
It's individual, yes. So initially, they are started on evidence-based medicine treatment. We also tell them that there is something else that you can do, like yoga, or sometimes some other psychotherapies, or depends on. So now epilepsy often is standalone, But there are about 20 or 30 or maybe 40% of patients with epilepsy, especially those with long-standing epilepsy, who also have other comorbidities, means other involvements, mostly related to the brain, such as, they could have the percentage is low, but they could have anxiety, they could have sleep disorders, they could have Parkinsonism, they could have early dementia, they could have
So all of this
all
could
of
be
this,
related.
So we always evaluate them for all this when they come in with a seizure. So they just come that the person had a fit or a seizure, became unconscious, and then we look at all this, we evaluate them with different modalities, like there are scans, there are PET scans and other things, and then is it purely epilepsy or is there an overlap with some other neurological disorder?
That must be tough to evaluate.
Now with a lot of things, now luckily we have a lot of evaluation gadgets, and science has,
the amount of patients you've seen, so you can
that's of course there, but today science is fairly advanced and we have all this available everywhere, so we can, so it does affect, so there are different neurological disorders which could be helped with yoga, and there have been a lot of studies on yoga internationally, especially over the last 50 years, and with good good scientific studies which have shown benefit in different disorders.
So can you give me an example of, is it poses, is it the breathing, is it a combination? Who would that help? And
it's really a combination, and there are studies, and I will talk about the studies that are published rather than just telling you just somebody's anecdotal experiences. So there's several studies that are there. Many of them deal with pranayamic breathing, so mostly breath related. Some of them deal with yoga nidra, and then some of them, of course, evaluate different subtypes of yoga. Like there are studies on Kundalini yoga. There are types of different Hatha yogas.
Wow! So you've done research on different types as well. Wow!
Not me, but people have done. People have done. So it's available.
It's available. That's fantastic. Yeah.
So it does have a sort of definite sort of a spectrum of different yogas that help different things. We're only talking neurology here, but it can help diabetes, it can help asthma, it can help other things, because eventually a lot of systems in the body are interlinked, and problem with one system may be because of some lifestyle disruption of another system. So that's where the whole medical field is getting at now.
Is it?
Yes.
I thought everyone is specializing and specializing and specializing.
No. But the research is now moving on to gut-brain axis.
Okay,
so in Ayurveda they talked of kapha, pitta and all those things.
Yes.
So that actually meant it is gut-brain axis. So we are doing research on that. Yeah, right? I told you that we are looking at culinary medicine and epilepsy. Soon people will be looking at these various things and dementia or Parkinson and all. So these researches are going on and will go on.
The research is going on, but when you go to a doctor, they will not evaluate you fully. They will say, okay, your shoulder is hurting, go to this doctor, or your
This is what is happening. But there are some orthopedic people who are also saying you could do yoga.
Yeah, that's good. I think it's slowly starting.
It's not going to be very easy to sort of inculcate these complementary therapies to evidence-based doctors, especially maybe if you want to talk about yoga in India, people might understand it culturally. But if you want to tell somebody in the US or in Japan or somewhere else about yoga, first they have a cultural block. They feel this is something religious, which it is not, right? And then you have to tell them this is the evidence. And then they might try it. Or if they come and actually see somebody doing it and get the story back that it really helped, it's going to take ages to sort of, but we want to first prove that it works.
Yes.
So we meaning
you've done
the whole community, and we are trying. We have done that once.
And you're doing it again.
And we're doing it several times. But now this is a big study in the Cleveland Clinic.
Yeah,
so we're waiting for the results.
That's in a year. It'll come out in a year. 1 year?
Should be. It's a 5-year project.
Fantastic.
And we've done 3 years. So I think we have already looked at interim analysis, which is looking good, but we will only, disclose it once we have the full thing.
Of course.
Right.
So what about food, diet? I know there's been a lot of research on keto and epilepsy, or what's your take on that?
The ketogenic diet is about a 100-year-old diet. and it was a very strict ketogenic diet where they required very high ketones, which is an abnormal physiological state that you produce.
Yeah.
And that abnormal physiological state can give you several benefits in terms of, stopping your seizures, reducing your weight, and maybe general feeling of well-being. But a very strict, a milder diet, but a stricter diet has its own side effects. So about 8% of patients would have very severe metabolic abnormalities. Another 10% would have changes in cholesterol and other stuff, because you eventually give them very high fat diet.
Right.
So now there have been modifications of that, about, modified Atkins and, low glycemic, and so many other diets have come out. And there are many more other fads which are, not all of them are researched kind of. So, but the researched ones are already available. And they do help to a certain extent, not completely.
It's hard for a kid to do.
It's very hard for
you just see all ages, I know. But
it's very hard for a kid. It's very, very hard for a teenager to follow it, because they have peer pressure.
Right.
Right. So it's not an easy thing to do. It's also very expensive.
Oh, the keto diet, because of protein.
Because whatever you use very high fat, and everything in all the fats are most important. The oils, butters, dry fruits, they're all very, very expensive. For somebody coming from a very low socioeconomic class, they can't really sustain it for long, because it has to be given for at least 6 months to a year, and then that becomes a big expense, right?
Right.
And that's on top of medication that you give them.
Yeah.
So we are not only talking about epilepsy, but people do ketogenic diet for several other reasons.
Yeah, I think you're right. And so a good Indian diet is fine, like regular.
I mean, for a routine patient, it's fine. It's only one of those most resistant epilepsies that have tried everything that we say, okay, now you can try keto and see what happens, right?
Then for the general public, especially kids, I would like to ask about our lifestyle now. Like we are not moving as much.
We are moving in the wrong direction, actually.
We're moving in the wrong direction.
Absolutely moving in the wrong direction. I'm a very firm believer in that.
So
especially with the screens.
With the screens. You tell kids to get outside.
And it's not only kids, it's adults as well.
Yeah,
because
and also worse.
They're worse, because then they are, in the family, you're looking at your cell phone, you're looking at reels, videos and stuff, and then nobody's talking to each other. Nobody's even looking in their eyes. So little kids with this loss of sort of contact, eye contact, emotional, support, they tend to be autistic.
Oh, that's why autism is increasing?
Which is,
okay.
Screen is one of the biggest sort of risk factors for that.
I thought autism is something you're born with.
See, there are several genes that have been looked at, but there is no single gene which is really linked, to autism. So you can have, in an autistic, if you did a whole exome sequence, you get several hundreds of genes which could be abnormal, or a few genes which could be abnormal, and different genes in different people, but there's no direct link to autism that this particular gene causes. There are very few of those, right? But it's mostly the environment. Typically, just two parents, both working in IT, both are busy, and especially what happened was during the lock-in, the pandemic. People used to be working from home. Both parents are in different rooms. There's probably a kid playing on his own, no eye contact. So we saw a surge of children with pervasive development disorders and autistic traits, and then we had to reverse them by sort of giving them different therapies,
Like which kind of therapies?
Different
psychotherapies.
Psychotherapies, occupational and physiotherapies, sensory integrations, because they need to be given that, the input. And so they develop abnormal connections, and that causes this kind of a scatterbrain kind of approach where they don't have good eye contact, and they remain in their own world, and they prefer to remain in their own world more and more. And they have abnormal actions like stereotypies of hands or repetitive syllable chanting and stuff. So they look abnormal, and their learning gets affected.
I didn't realize that it was so
right.
Something that we did.
So it's all lifestyle.
It's lifestyle. I just thought it was something you're.
No.
Oh, wow.
It is, yeah.
Okay, so guys, this is an important point.
So important. So no screens for kids, as little screen for adults as possible, and you'll be happy.
Wow. Right? I'm just still processing what you said.
We see it every day.
Yeah, you see it every day. I didn't realize that
at least a couple of kids every day who have sort of gone down. They had a nice neurological and cognitive development, language development. Then their language goes down, their cognition goes down.
Yeah, because you've been seeing them since birth, or like since
or they come to us and with a history that they have done well, and then around a year and a half when they can actually handle. Now kids can handle, 1.5-year-old kids can handle mobiles very well.
Right.
They can, open what they want, and so.
Wow. So for those couples or families that are just trying to make a living, they have to pay their EMIs, and they both have to work. Any suggestions or something to get them off the kids outside or?
Yes. If they have support in the family, like grandparents, that's the best.
Yeah.
Because this
ancient system.
But not
our
everybody.
Ancient system.
Our ancient system. But it may not be possible because people are they have to
living
relocate.
Away.
They have to locate to different places depending on their jobs and stuff. They may not have the support for several reasons. But then, if they have somebody else in the house who's looking after the kids while they're away, or a good daycare where there is activity, there are other kids, so they interact with other kids, so they don't lose out on all this.
Yeah, I found
emotional
that daycare
eye contact and the input that the brain needs. So a child normally is born with, if you need say 10 million sort of connections in the brain, you're probably born with, let's say, 100 million or more than that, or 500 million. And as the child grows up and with all the inputs, the connections that are needed for day-to-day life remain, and all the other connections are sort of pruned and gotten rid of. Now, this doesn't happen if there's no good input.
Right.
And they have too many connections, so they become scatterbrains, hyperactive kids, disruptive kids, and so on. So that is the essential process of a child's brain development, where all this affects us. So lifestyle is very, very important to answer your question. And the first one is screen. Second thing is the diet that they're given. So abnormal diets, like junk food and all that, the Ajinomoto that is put into all these restaurant foods does cause, disruption of brain activity and the brain structure.
So
and the
that's
chemicals
thing.
in the brain.
Food,
so be careful.
Yeah. So food, screens.
And the third thing is sleep.
Sleep. Okay.
Sleep is again very, very important.
Are kids having trouble sleeping?
A lot of kids are having trouble sleeping because the parents get back from work late.
Right.
And then the kids are waiting for the parents to come home, but that's the only time that they get to interact with the parents. So they don't want to sleep. Many people come home and they cook after they come back from work. So they have dinner at 10, then they want to watch TV. The kid doesn't want to sleep. So it's happening to kids. It's happening to adults because adults are into a lot of different things. Suddenly the world is different now. In the past, people would do 9-to-5 jobs. They would come home. They would have the evening free. They would eat early. They would turn in early, which was all very good because they would get 8 or 9 hours of sleep at night, at least 7 or 8 hours of sleep. On average, a person living in urban India today does not get enough sleep because they end up finishing the day late. They want entertainment after a hard day's work. And then they sleep around 11:30, 12. They have to wake up at 5 because the kid goes to school at, say, 6:30. The mother has to wake up and, get everything ready.
And this is in addition to most Indians are working in other people's time zones.
That is different.
It's a horrible thing.
That's a horrible thing. I mean, that compounds everything,
Yeah.
Yeah. And then what happens is a chronic lack of sleep, even for an adult, causes more rapid sort of disruption of the lifestyle, and then anxiety. It has effects on your immune system, so they can have more infections. The overall neurodegenerative process that used to happen in 70s and 80s in the past is now coming, the age is coming down. So they're sort of midlife or just after early senior citizens are getting into neurodegenerative processes. Wow. So it's pretty bad. I think we have to really, really think and revamp our lives. Make sure you get 7 to 8 hours of sleep at least. And the kid should get at least 9 to 10 hours of sleep below the age of 5 years.
Okay.
Right.
So you heard it from the expert pediatrician and neurologist. And so please keep all these things in mind. We are going to have another episode with Dr. Yardi soon, all about sleep. So stay tuned. But Nandan, thank you so much. I think every mother and every to-be mother should be, mom and dad, not just mom, parents, I mean, should listen and take your advice, your research, and really put it to heart. And everyone should do yoga. So
it's been a pleasure being here at the breathing room. You have such a fantastic yoga setup here. You're doing excellent work. Yeah.
Thanks, Nandan.